My name is Thomas Smith. I've suffered 3 separate paralyzing accidents. I'm the first person in documented medical history to recover from multiple paralyzing accidents.
I am Keith Cooper. I am a physical therapist for professional physical therapy.
Keith and I started working together in the fall of 2017. I was getting ready to, I was preparing for my first Boston Marathon since my paralyzing accidents, and we worked together from about October right up until a week or 5 days before the marathon. And then we continued that last year through 2019, and then here we are in 2020 and going for the three-peat, and I'm feeling very fortunate this year that Keith's going to be doing the marathon with me.
Tom is someone that I've known since he was a little kid. I played baseball with his brother and kind of was always familiar with Tom and his family, and just being local guys from Swampscott. And then when he had his injuries, it was something that I followed very closely. And I remember seeing his dad one day, and I was like, you know, if there's any way that I can help with Tom and his foundation, because I was in the process of going through PT school, please let me know. And by chance, Tom was looking for a physical therapist to help with some hip issues that he was having as he was training for his first marathon. And it was like we were two brothers, hit it off right away, and got him through that first marathon. And through Tom's use of needing to use his arms for ambulation, he was left with a rotator cuff injury, which has been the biggest focus of our treatment over the last year or so. Getting him back, one, so he can walk normally and have normal mobility and dressing and things like that, but also to help raise money for his foundation and helping those other people who are dealing with issues with paralysis.
It's the Boston Marathon. So when I got hurt my first time, I ran Boston 4 months before that. So I did it as part of my senior project in high school, and then 4 months later I'm paralyzed from my neck down. And so in 2018, it was 10 years from that accident. And so two things doctors said I'd never be able to do was ride a bike and do a marathon again. That was across the board, every doctor I saw. So in 2018, to celebrate and bring attention to what we've been able to do over the last 10 years, I wanted to do something that doctors said was going to be impossible. And I did it. So I became the first person in the 122-year history of the marathon that's been paralyzed multiple times to complete it without the use of a wheelchair. And then last year we repeated history on the 10-year anniversary of my second accident. And this year is specifically special, not only because Keith has been such an instrumental part of getting my body ready to do a 26.2 mile walk when doctors said I was never going to be able to do it, but this is the 10-year anniversary since my third accident on January 11, 2010. So when I think of this is really bringing it full circle, and I think it's appropriate that Keith and I are doing this together. He played such a big part in both marathons before, but this one is really, it's the best way to describe it is full circle. It's the journey of coming back from the accident. It's the journey of being on my feet, and I think it's the journey of accomplishing something what people said, because it's never been done, is impossible. So it's going to be it's a big deal. It's a big deal for me, but I think it's a bigger deal for the paralysis community, because it's showing where modern medicine's going, where proper therapeutic treatment's going, and where, if you have the right resources in place, what the body, the human body and the mind can accomplish.
Tom presented the opportunity. He said, I have an idea, and I kind of had a thought of what that idea was. And when he said, would you be willing to walk it with me as a guide, I was like, yeah, I'm in, sign me up. Just to have that experience, to do it together, because the amount of hours that we've spent together over the last 3 years trying to get him ready, and here's a way for us to kind of do something together and just see what an amazing accomplishment it is for him, and then for me just to kind of be there and complete my first marathon. And I'm not going to run it. I don't think I could ever run it, but just happy to have the opportunity to be able to walk it with Tom and cross the finish line together, and help just raise awareness for such a great cause, and to just show kind of the relationships that can be built between physical therapist and patient, and just what you can accomplish together to achieve a goal. So.
After my second accident, I really had to pivot, and figure out what was my purpose in life. Because I tell people, for the first 20 years of my life, I lived with a passion for hockey. And then the last 10 years, I've lived with a purpose. And that purpose has been the Thomas E. Smith Foundation. And the co-founder, Tucker Mullen, and I actually came up with the idea from my hospital bed. I wasn't doing so well mentally and physically after my accident. And he identified that early on and said, we gotta obviously move on life after hockey and figure out what's going to drive you and what's going to get you up every day when it comes to physical therapy and just also being a member of society. So we came up with the idea in October 2009. We got licensed and officially incorporated in Massachusetts in May of 2010. And going on, this May will be 10 years. It's been an absolute pleasure, journey, and easily the most fulfilling thing that I've ever done and been a part of, because with the foundation, it's a team. There is no one individual that's driving it. It's called the Thomas E. Smith Foundation because we utilize my story and the great fortune and success that I've had to hopefully inspire people with paralysis, but in no way, shape, or form is it just Thomas E. Smith. It's branched out to over 100 people that either volunteer, provide medical treatment, or assist in some way. To date, we've raised over $425,000 that we've donated. So $425,000 donated to individuals that are suffering from paralysis, as well as medical research, supporting different STEM and Schwann cell clinical trials that are happening specifically in Miami, Florida, at the Miami Project to Cure Paralysis. So when you look at the body of work, and we're approaching within that 425,000, almost 40 individuals that we sponsor, whether it be buying them adequate wheelchairs, going in, modifying their homes, whether it's us installing elevators, widening doorways. Our philosophy behind the foundation is no one should be denied accessibility based on his or her injury. So where we go in and say, okay, you're getting covered for this by insurance, but it's not enough. They don't teach you how to live with paralysis. It's like, okay, how are we going to get out of this situation, right? Whether it might be just, movement in your arms, movement in your hands, whatever. Trying to maximize what an individual has. I mean, it's without PT, you don't make progress, right? Because you think of the situation with paralysis, and you have the doctor that diagnoses you, but I would argue that nurses and physical therapists are the two most important people. Nurses when you're in the hospital because they're seeing you on a daily basis, and then physical therapists once you get out. Doctors are important with the proper diagnosis, but physical therapists are the people that are working with you on a daily basis. They're the people that are monitoring your body. They're the people that are getting you going, whether it be flexibility, blood flow, and whatever the situation may be based on his or her injury. If you don't have a good physical therapist, in my opinion, you're not going to achieve maximum success and mobility with what you're trying to do, whether it be, you break your arm and you're trying to heal properly and be able to go back to everyday life, or you suffer something as devastating as paralysis. I think it's across the board. You need a physical therapist that understands, pressure points, the way your body's reacting, and how to push you in a way that you don't hurt yourself.